Welcome to Hearing Matters with Dr. Gregory Delfino and Blaise Delfino of Audiology Services, the show that discusses hearing technology, best practices, and a growing national epidemic, hearing loss. I'm your host, Marty Wolf, for the Hearing Matters podcast. Welcome back, Dr. Delfino and Blaise Delfino. Welcome back to the studio.
Glad to be here, Marty.
Happy to be here, Marty.
This is going to be another fun one.
We're excited.
Yeah,
Absolutely.
It's going to be another fun one, primarily because I guess we'll be talking about going back to school. So there's a lot of important facts that you're going to share with us. But let me start the show off this way, if it's okay with you, Blaise.
Absolutely.
So you sent me a few fun facts. So listen to this, folks. According to the 2019 National Retail Federation survey, families with elementary, middle, and high school children will spend a total of $27.5 billion, or an average of $685 per household to ready their kiddos for the new school year. Well over half of their spending will be for clothing and shoes. Nowhere in here does it say anything about hearing tests for your kids going back to school. Blaise, I'll go to you first. Is this kind of important stuff?
Oh, well, absolutely. Absolutely. Hearing is one of our senses, of course, so we want to make sure, and with episode 2 being back to school hearing tests, that every child in elementary school, middle school, high school, college, every one of these students gets their hearing screened.
Yeah, so Dr. Delfino, again, welcome back. Well, why is this important? I guess some research has told us that, maybe even common sense. If you have a hearing loss when even a young child, even the preschool level or kindergarten level, you could fall behind. Am I accurate with that?
Absolutely, Marty. Without the ability to hear, children are at risk for falling behind in their educational progress forward. Having the hearing tested initially for back to school puts them on par with those children that we already know have normal hearing. But again, it's an opportunity to make sure that they are in fact getting everything that they can from the educational experience. So an essential part of that back to school protocol.
I think when you were saying that, Dr. Delfino, I was thinking of not only the educational part of it, but the social part of it. They're connected, are they not?
Without a doubt. Children with hearing loss and adults as well, but hearing loss oftentimes creates a very isolating impact on us socially. And so some of these children are afraid to become engaged for fear that they may not have understood what was being said. They may struggle with understanding what the teacher is saying, and so that they're not as engaging as they should be simply because they're not quite sure of what they heard.
At the beginning of the show, Blaise, we talked about it being an epidemic.
Absolutely.
I believe that's an accurate statement. So we're here to try to deal with that, I guess, a little bit. So the diligence in doing hearing tests have gotten better, right? They have one at birth, I guess, right?
Yes.
Right after you're born, as we move through life. But talk to me about what other tests are occurring for school-age children or otherwise? Talk to me about that.
So students in elementary school are having their hearing screened. And again, a screening is very different from the diagnostic evaluation that is completed by an audiologist or hearing healthcare practitioner. What the screening shows is, does the child need to be referred out to the audiologist, to a physician, to kind of dig a little deeper? Mm-hmm. It's very important that the students in elementary school, especially because of the auditory-based communication that's occurring in the classroom, that they get screened annually.
Yeah.
From my experience being in college and having been at East Stroudsburg University, Dr. Miller, who's the audiologist there, set up a screening protocol for collegiate students as well. So
interesting. Yeah.
And most of those students, when we asked, when was the last time you had your hearing screened? Elementary school.
Yeah. So another interesting fact that you shared with me, I find this interesting. By age 5, children should be able to speak in sentences of more than 5 words. Now, I have a grandchild that's 2. She can speak a whole paragraph, but I guess she's special, right, Dr. Delfino?
Absolutely, she is.
By age 5, so what's on my brain here is, so how do parents, educators, how do they detect this? I mean, you're 3 years old. I mean, how do they detect this? Or should everybody at that age get tested through an audiologist?
Well, Marty, again, with the advent of newborn hearing screening, has certainly elevated the level of awareness that hearing has such an important part in speech and language development, but it doesn't end there. Children need to be screened routinely, certainly at the age of 3 and prior to entering into formal education. Things like child seeming inattentive, child having some significant articulation issues, child not seeming to respond appropriate to requests are certainly some soft signs that there may be something going on, and it's time to certainly eliminate hearing loss as a possible factor in this.
Yeah, I could see this. So, Blaise, you're going to talk to us a little bit about speech language pathologists and the children, how they're able to decipher communication, I guess, with other children. Talk to me about that. Consonants, I guess, is what we're talking about?
Absolutely. So
explain that to me.
If a child presents with a mild to moderate hearing loss, the high-frequency consonant sounds such as F, S, and TH, these children are not hearing those specific consonant sounds with increased clarity. Now, especially if that individual, that student, presents with a hearing loss and they are receiving speech therapy for, let's just say, articulation, that individual and that student might not be able to tell the difference between the f sound and the v sound. Same placement, one is voiced, one is voiceless. And consonants carry 10% of the audibility, but 90% of intelligibility.
Interesting. So again, I'm learning as I'm listening to you, and I'm going back to my own life and to my own children and grandchildren, and the importance of getting this done early and with some regularity. It's age 3 is the best time.
Age 3 is certainly an appropriate time. And again, it's going to vary. Some children are predisposed to late onset of hearing loss. And again, working in concert with the pediatrician, that's going to be part of their routine setup. But certainly 3 and beyond, we certainly like to see what's going on with regard to speech and language and audition.
So you are listening to Hearing Matters, the great podcast that we are talking about hearing. And we think there is actually an epidemic in the United States and maybe worldwide. We'll talk about that maybe on another show. And our guests are Dr. Gregory Delfino and Blaise Delfino. Blaise, people want to hear more about your company. Where do they hear more about that?
To learn more about audiology services, you can visit audiologyservicespa.com. Again, that is audiologyservicespa.com. So
we talked about, especially when you're younger, your inability, I guess, to understand, you're not hearing something. So maybe your social development is impaired also, in addition to your educational impairment. I could see this. But does a hearing loss have any potential impact on other health problems? We'll turn to you, Dr. Delfino, for that.
Well, health problems, certainly it has a huge impact on academic issues. And again, talking about going back to school, children with hearing impairment, and again, it can be either from fluid in the middle ear space, something congenital going on, again, first detecting where that's coming from, it's going to have an impact on the way in which they learn in every aspect. One of the issues as well about hearing is that we need to somewhat use it as a differential diagnosis between children with attention deficit disorder, children with central auditory processing assessment. Oftentimes, the behaviors of these children is somewhat similar, and so using a differential diagnosis with hearing loss certainly helps us to narrow down what's going on, and again, to focus on what remediation needs to take place. So hearing loss, again, masks itself in many different ways and takes on many different shapes and forms, and we need to be able to detect it and move forward with remediation.
Yeah, if the child can't hear well and can't communicate well, they may be mislabeled as a troubled child or a child with attention deficit disorder when maybe that's not the issue. Exactly. Right, Blaise?
Absolutely. And to dovetail off what Dr. Delfino had said, especially with the social cues, pragmatics is the social use of language. So if a child presents with a hearing loss, it is likely that that specific individual, if left untreated, will have a difficult time in years to come with the social use of language.
Now we're painting a very unhappy picture here. But again, correct me, I'm not the doctor, I'm not the specialist. Sometimes it's as simple as earwax, and sometimes it can be that simple, could it not? And I'll be positive for a minute.
Yes, Marty, it can. In the school-age population, the earlier kids, younger children, that is the time when the incidence of middle ear effusion or middle ear fluid in the middle ear space is most significant. And so if a child has got an ear infection, that will impact the way in which they are hearing, and it does so in a very transient way. The child has some fluid in the middle ear space that may last 4 to 6 weeks or less than that, and then the child hears well again. But it's that fluctuation in hearing sensitivity that creates the wonder and the concern about how well this child is developing speech and language. So again, following up on that issue as well, the middle ear is huge.
So let's progress along a little bit, Blaise. So we're talking about primarily younger students.
Absolutely.
And so you go through high school, like I did, knowing I was something wrong that I couldn't hear well. But when you get to college, let's talk about how important it is when you get to the high school level or the collegiate level. I mean, this can get progressively worse, can it?
And going from high school to college, and of course the course of action is typically after college, you're going to be entering the workforce. And we found a very astonishing statistic, Marty. According to the American Speech Language Hearing Association, children who may have mild to moderate hearing loss but do not get intervention services are very likely to be behind their hearing peers by anywhere from 1 to 4 grade levels.
Wow.
To expand on that, 122 billion is the estimated cost in lost U.S. earnings due to untreated hearing loss. Now, if we go back to individual college student just entering college, the next 4 years are going to study their specific scope, and then after that, they're going to get a full-time career. It is so important that they get their eyes checked, they get their teeth cleaned, get your hearing screened.
I love that.
Yeah.
Say that again.
Everyone gets their eyes checked and their teeth cleaned. Let's get our hearing screened.
Wow. That's
I didn't come up with that, so
that's nailing it.
I'll take credit.
Why not? Why not? Because you can see, how it affects individuals, how it affects families.
Absolutely.
Obviously, as you get older, and there's different things that happens to your health. I'll go back to Dr. Delfino again. So we detected this, or maybe not have detected this until we get older. A hearing loss can affect your quality of life in a big way. Actually, aren't there studies that talks about dementia and all these other kinds of issues? Maybe I'm jumping the gun a little bit because we wanted to stay with the school, but I'm carrying it right through to older age. So talk to me a little bit about that.
Absolutely. The impact of hearing loss is significant on almost every aspect of life. And again, as we move through life, it becomes that much more impactful on the areas in which we're trying to move through. In the academic world, those children have more difficulty learning. In the working world, those adults have more difficulty getting jobs. And it's interesting, Marty, we see this on a rather regular basis just through the eyes of our patients who have described for us what these experiences have been like. And it certainly, again, brings home the impact and the importance of how hearing loss influences and can really deleteriously affect the quality of people's lives, and why getting help and getting the right kind of intervention makes the world of difference for them.
Yeah, Blaise, what do you see or what are you experiencing in your practice or across the whole spectrum of your work? Are schools cooperating? Maybe that's an unfair question, but talk to me about that. School-age children, especially younger children, is there dialogue between your industry practice with schools? Is that getting better?
I absolutely believe that it is. Not only our practice, but practices across the nation are increasing awareness of overall hearing health and the impact of untreated hearing loss and being exposed to noxious noise. such as concerts and dances. And especially with going back to school, there are absolutely different preventative measurements that can be utilized and carried out, such as if we have students who are in elementary school, high school, and college that are in the marching band or the school band, hearing protection is a must. If you're on the dance team or you're a cheerleader and you're exposed to loud music during rehearsal, hearing protection is a must. So there's especially school dances, prom, homecomings.
Yeah, like you and I probably stood in front of the speakers. Probably that's the wrong thing to do,
did,
right?
Marty. I did.
Oh, that's right. You grew up in a home that you were protected against that. Well, my mom and dad didn't realize that. I was right in front of those speakers, Dr. Delfino. No wonder why we're hearing technology, for goodness sake, right?
Exactly.
If somebody told me, I might have changed.
No, absolutely. And to expand a little bit more on your question, Marty, what are we doing as a practice, but also hearing healthcare professionals? Number one, educating not only the students, but also the teachers, because
that's important. That's, I guess, what I want to know.
Yes.
Are we educating teachers?
Absolutely. And so in the classroom, if a child presents with central auditory processing disorder or a hearing loss, there's something called an FM system. And really what that does is that increases the signal-to-noise ratio. And we're firm believers that FM systems should really be in every classroom because...
Well, explain that to me.
So
what do you mean?
Think of a speaker in the classroom, like a DJ speaker. And the teacher's voice is actually elevated. So this not only allows for increased attention for the students, but also it decreases vocal abuse for the teachers. While I was on my medical externship, we saw a few teachers and professors who had vocal nodules because of vocal abuse, of yelling over the students and things like. So it not only helps the students, but also the teachers. But the teachers today are especially educated on overall hearing health, and we have to keep that education.
Yeah.
Absolutely.
Well, in my days, they had blackboards. I don't know if they still have blackboards or not, Dr. Delfino, but I'm sure the teachers once in a while turn their back, and maybe that's part of they turn their back. And I know I couldn't hear them, when they turn their back. Exactly. Now, when somebody turns their back on me, I have a hard time hearing. So this whole idea of this improving that, I guess, makes sense, does it not?
It absolutely does, Marty. And we've known this for a long time that in the classroom it's a noisy and unforgiving environment acoustically, and so that for the child with minimal hearing loss or auditory processing, or even a kid with attention deficit disorder, anything that's going to distract this child or pull them away from this main auditory focus is going to create an impact upon the way in which they perform. So using FM systems, or even we've got some children in the field that are using hearing aids with remote microphones, which is a way in which So
they're picking up the sounds?
What's happening is the teacher's actually wearing the remote microphone, and the teacher is in direct communication with the child, which is wonderful. So if the teacher turns their back, or even if they leave the room, the child is able to hear exactly what's going on.
Wow. This is so many lessons crammed into one show.
I hope you learned a lot today, Marty.
This is unbelievable. So we kind of need to start to wrap up. So there's all kinds of information. We are definitely talking back to school. And I'm going to read something that dovetails in what you said. Protective measurements we as humans use are sunscreen, glasses or goggles, helmets when riding bikes, football helmets, baseball helmets, seat helmets. Are we wearing our hearing protection, folks, right?
We need to.
Are we wearing our hearing protection at all ages? So, Dr. Delfino, what didn't I cover that you want to make sure that we get out there for?
Marty, what I'd like to end with is certainly a quote from Jay Mendel, who is one of the foremost pediatric audiologists in the country, and she talks about children and children being able to understand speech. And her quote is, "Audibility is not a guarantee of intelligibility, but lack of audibility guarantees the lack of intelligibility." The child needs to not only hear the sounds, but understand them. That's the essential part.
Yeah, understand them. Wow, this is critical information. Parents, teachers, business people, anyone listening to this message, I think I know you should be paying much more attention. So tell us more where they can reach out to you, Blaise, and to Dr. Delfino.
Absolutely. For any questions, comments, you can reach out to our team by visiting our website, which is audiologyservicespa.com. Again, that is audiologyservicespa.com.
So, another great edition of Hearing Matters podcast with Dr. Gregory Delfino and Blaise Delfino. Thank you, gentlemen.
Thank you, Marty.